Good afternoon, everybody. Welcome to our media question and answer time related to COVID-19 in Eau Claire. We really appreciate you joining us. Today is Thursday, February 25th. It is our time where we share with you a little bit of data, share some updates that have happened at a local and state level, and also talk a little bit about the questions that our media partners have forwarded to us in advance and walk through those questions, as well as take any additional questions from the media via chat or at the end. So again, thank you for joining us. We're glad you are part of getting information out to our community about COVID-19. I'll start with Eau Claire data like we always do. Our case count for people in Eau Claire County that have tested positive for COVID-19, we are now at 10,977 individuals. That's an increase of 82 people since last week, Thursday. We're averaging about 12 cases a day the past 7 days. Our goal, again, is to be below that, but we are certainly at a better place than we were even a couple of months ago. So the good news is that our case numbers are seeming to remain fairly low, and that is positive. We have about 114 people in Eau Claire County that are currently home being isolated for COVID-19 and all of their close contacts as well. 351 individuals have been hospitalized, and we have had 104 of our friends, families, and neighbors that have died related to COVID-19. No increase since last week, Thursday, which is, again, very good news. We continue to track our cases connected to UW Eau Claire, like we've shared with you since the start of the this year with UW Eau Claire. About 13% of our total cases are UW Eau Claire connected. They continue with their testing protocol and are testing on-campus students, off-campus students, and faculty and staff. There are currently 33 active public health investigations. Those are at work sites, long-term care facilities, schools, and other settings. We are continuing to be rated in that high COVID activity level by the state. That state activity level is really looking at how much disease spread we are having in our community currently. We currently have 163 cases in 2 weeks, so that puts us, anything over about 100 cases in 2 weeks, puts us in that high space for COVID activity. The trajectory, though, the change of those numbers is staying flat, and that is, again, very good news. We hope to go below that high level soon, but it'll take some time before that happens. Our positivity rate is at 3.8%, a slight decrease from last week. It's the lowest positivity rate that we've seen since summertime. Our testing continues a trend downward. We only had 340 tests a day last week. And we want to make sure people still take seriously that testing needs to be part of our plan to move forward. There are tests available for COVID-19 every day of the week in Eau Claire County, and you can go to our website, COVID-19 Eau Claire, and find the full listing of all of those available testing resources. It's important for our healthcare system, for our schools and businesses, that we quickly identify people that are COVID positive so that we can make sure that they are not spreading disease to other people in our community. Our regional hospital bed space has been good. It remains at green. ICU bed space is also in the green level. So as we monitor those trends for our hospital capacity, things are looking really very good right now. Community spread, though, now is at 47% in the red, much higher this week than previous weeks, so certainly something that we are watching carefully. Our case contact, or how quickly we can get to our cases once they are identified as positive, is now at 93% of people that test positive do get a call from us within that first 24 hours. That's remained fairly steady. There is a lot more data on our website. If you are someone that likes to follow that, and I know many people do, please go to our website, covid19eaugclair.org. There is information on our webpage with all kinds of data sources and a lot of information about testing and what is happening with COVID-19 in Eau Claire. Our state data, we are now at 562,151 individuals that have tested positive for COVID-19 in Wisconsin. There are close to 8,500 active cases in the state, and the state rate remains high for COVID-19, that COVID-19 activity level, the same as what's in Eau Claire. 6,394 individuals have died related to COVID-19, an increase of 162 people since last week. A couple of updates for you then. Do remember that starting March 1st, Monday, there will be new groups that are eligible to receive COVID-19 vaccine. I'll share a number of updates related to vaccination, but do know that the groups that will be newly eligible starting next week include K-12 and higher education educators and regulated childcare providers. So our broad group of educators that are providing front-facing services to people as educators will be eligible to receive vaccine next week. Our essential workers that deal with the public in utility and IT positions are also eligible per the state, as well as some specific food and agricultural workers, some additional healthcare personnel that are connected to their healthcare essential services, and people that live in congregate or group settings. That entire population was made eligible by the state starting March 1st of this year. Many of these groups are eligible through their employment, and they have received through the networks that we have in Eau Claire County, a whole variety of networks, some basic information about their eligibility, how to find appointments in Eau Claire County, our COVID-19 vaccine webpage that lists all of those resources, and information about how to get ready to have that start happening next week. Again, our website is the best source of information to go. All of the vaccinator groups that are vaccinating the general public are listed there with easy links to how to get to vaccinations with that entity. Those employers, again, who are connected to the Chamber of Commerce or the Chippewa Valley Economic Recovery Task Force or a number of other networks, did receive some information about this March 1st start. If you're somebody that thinks you're eligible in those groups and did not receive information through one of the partnerships that we have, please go to the covid19eaugclair.org website. We encourage you to review the material there. And certainly if you have questions, please don't hesitate to contact us. That call center number is 715-831-7425. The new eligible groups are important, and they are an important part of our community. We also need to remember that not all of our 65 and older population has been vaccinated in Eau Claire County, and that's a critically important group. The state remains committed to prioritizing that group first as much as possible, even though these additional groups have also been named starting next week. I do need to say to everybody that vaccine availability is based on how many vaccine doses come into our community and come into the state. We are continuing to coordinate across the Chippewa Valley. All the vaccine providers are working together, and we have a lot more capacity in Eau Claire County than vaccine supply. We are receiving less from the state with every request that is made from all the vaccinators. In Eau Claire County, as a health department vaccinator, each week we have asked for many more vaccines, and we have received for our mass vaccination clinics that we've held at North High School and in Augusta most recently. The allocations did not improve for our allocation starting March 1st, so we do know how many doses we will be getting, all the vaccinators do for next week. And despite having many more eligible individuals We did not receive more vaccine for those new groups. The state did name specifically educators as a priority for the first group, starting out with this new group of eligible individuals. But no vaccine was allocated next week for those groups, although today in a press release and in some media outlets, the state did report that they will be setting aside vaccine for the educators as part of the doses that will be going out. That has not yet started. It will not start until after March 15th. And the allocations for next week really were distributed with the previous model that was really based on factors in their formula that were connected to our 65 and older population and other factors that the state is working with. We know that there continue to be 65 and older individuals that need to be vaccinated, and our healthcare system partners are working through their patient lists to get those individuals vaccinated. We ask people to have patience. Those 65 and older are able to go to the other providers that are receiving vaccine, including our health department clinic and Walgreens and Walmart and many other providers. Please look at our website and look for those various locations to get vaccination if you are 65 and older and have not yet received a vaccine. If you are eligible or soon will be eligible, a vaccine will be available for you. We know it's hard when there isn't sufficient supply right now, but do know, for example, our education group has been prioritized, and there's a strong commitment in the Chippewa Valley to move our educators through as quickly as we can in March and early April. We hope that with more vaccines being approved by the FDA and more supply coming into the state, that we will continue to have good success in getting vaccination into people in Eau Claire County. I do want to say, in a very positive way, we are making amazing progress in this community. The vaccine that is coming into Eau Claire is getting into arms quickly. 27,355 doses have been given to Eau Claire County residents to date. 17,000 have gotten at least one dose, with the remaining doses resulting in a completed series for 10,000, more than 10,000 people that live, that are residents of Eau Claire County. 57% of our 65 and older population has been vaccinated with at least one dose. And that is really good news. That's our highest risk population, and one that we are certainly targeting, as is the state and really everywhere across the U.S. If you go to our COVID-19 Eau Claire website and click on the vaccine appointment button, you will get to a place where you will have available to you all the types of entities that are providing vaccine. Again, if you have a primary care provider, one of our healthcare institutions, please start there if you can. Schools are being coordinated with the health department, and we are encouraging you to work with your school entity and take advantage of the the vaccination appointments that will be happening through the health department mass vaccination clinics. But certainly there are many, many other opportunities for vaccine as well, despite the fact that there is limited supply. We know some people struggle with the technology-oriented appointment scheduling that we have in most of our entities across this area. If you know someone that struggles with having language barriers, transportation barriers, or technology barriers, please reach out to our call center. The Aging and Disability Resource Center is also a resource to connect with, and we will make sure that people are able to get a vaccine appointment as they are eligible, even if they have those barriers. I'll jump into some questions that we got in advance, and then certainly if there are questions from the media that come in, Audrey can help me go through those. So to start with is a question that I think we largely already talked about, but I'll make sure that we walk through that again. We have talked before in a couple of forums that the state expects a larger allocation of COVID-19 vaccine in the upcoming weeks, and that the state will reserve some of those doses for educators or teachers. Does the health department know around how many educators in Eau Claire County it hopes to vaccinate, and why they'll be prioritized first starting March 1st? So I'll share a couple of pieces of information about that. First of all, the state is getting more vaccine these last few weeks than they previously were. Previously, they were getting about 70,000 doses a week coming into Wisconsin. Now they are around 115,000 doses a week coming into the state. That's still far less than what they need in order to vaccinate everybody in our state, obviously. But the volume of vaccine has been increasing over time. The state has indicated that they will be using some of this additional vaccine to set aside for a pathway to get educators vaccinated. That has not yet started. It will not have started on March 1st. It is our understanding, we are finding that out this week, that process will not start until after March 15th. So no vaccinator will have a specific allocation of doses for our educators until after March 15th. They will be eligible March 1st. We will be vaccinating some educators, but we will have a smaller supply available than what we were hoping starting March 1st. In Eau Claire, we know that for our K-12 educators and our child care educators, we have about 2,500 individuals that will be eligible March 1st. An additional 1,500 or so higher ed, CVTC, UW Eau Claire, those groups of individuals that meet that education definition are in that group. About 4,000 people in Eau Claire County that are eligible. Again, there's some variation because of things like the child care numbers are a little bit less secure, but certainly we have many people in Eau Claire County that will be eligible. Our intent is to work through that list in a prioritized way starting next week, but as we get more vaccine available, our available appointments and numbers of clinics for those mass vaccination clinics will increase. Right now, we'll be doing about 2 a week, and next week we will have a clinic for specifically educators on Wednesday and Saturday, and other vaccinators will also be supporting that population at the same time, making sure all of us will be, that those over the age of 65 are also included in that group. We hope by early April to have a good proportion of our educators vaccinated, at least with their first dose. We know it's an important population to protect because this group is really working face-to-face in classroom situations, whether they are childcare classrooms or our K-12 system classrooms, with populations that we all see as critically important to be engaged. We want kids in school. We want kids to have safe and healthy daycare options. And so the state has prioritized that group through their process, and we certainly locally see that as important as well. The health department, because of limited vaccine supply, will be prioritizing further in that group to really name that those educators that have the most hands-on situations with young people where they can't easily distance, those educators that are in older age groups or that have chronic conditions, and those educators that for other reasons might have outcomes that are more challenging for hospitalization and death. We will be prioritizing those groups because of limited supply again. We also know that if we don't have teachers because they are out ill with COVID-19 or they are close contacts of those, schools have struggled to keep classrooms open. And we want teachers to be healthy and not with COVID-19. So that as much as possible, we don't have them home because they are isolated or quarantined. Vaccination is a clear strategy to make that happen. We are in process of working with the state to look at that allocation of vaccine after March 15th. So we will be submitting a survey as part of the state process to look at our numbers of eligible educators and to demonstrate to the state that we have a plan to work through those with our partners in Eau Claire County. We also got a question about the fact that COVID-19 vaccinations aren't yet approved for those under the age of 16, and how important is it that children be vaccinated as part of our process to get enough protection in our community that we have less concern about the spread of COVID-19. Lots of language in the general public about herd immunity. That is the idea that if we can get enough people that will be protected through vaccination or through having had disease in some disease processes, that the likelihood of spread slowing down greatly will be there the more people that we have vaccinated. Just over 80% of our population is probably where we would like to be with herd immunity. And it happens that just over 80% of our Eau Claire population is over the age of 16. It's a tall measure to get really as full vaccination as possible in our over 16 age group, 16 and older age group. We're going to work hard at that in Eau Claire County. We're well on our way with the 65 plus age group, and we are really hoping that we can build strength in the number of people that are vaccinated to help protect our businesses, our schools, and the public from more spread of COVID-19. We additionally got a question about rumors related to some people that aren't currently eligible getting vaccinated in Eau Claire County. The specific question was related to teachers receiving vaccine early. The question is, can I confirm or deny this? I will tell you that some educators, some teachers were previously and are currently eligible to receive vaccine if they are providing healthcare related services. They are considered a 1A population. Even though they work in a school, they are providing services that are, whether it's specific services with special needs populations in the schools, as school nurses, and other populations that are, other teachers that are specifically eligible under 1A. It is also possible that some people are not following the process, and it is a process of attesting or saying, yes, I meet eligibility requirements, and we are trusting people to do that. It is possible that some people have not done that, but our systems are in place to make sure that those that are eligible get vaccinated, and when people sign up for a vaccination appointment, they really need to read and review and be sure that they are eligible, and only then sign up for an appointment. We need to really work through this so that those people that are most at risk get vaccinated first, and that's why there is this tiered approach to moving forward. Additionally, there's a question about hearing from some of the healthcare facilities, a couple of our vaccinators that have posted in the last couple of days that they had immediate openings for vaccination. We also know that some of our vaccinators have been booked for weeks or months at a time, and there haven't been available appointments. We do have some variation of that in our community, and that's true in other communities as well. Some of our vaccinators this week did have available appointments that were not getting filled. We certainly encourage you to watch for those announcements that are made by vaccinators when they do have unexpected appointments available. This week, I know Prevea made an announcement about that, as did Oakleaf Surgical. So watch for those announcements, and if there are available appointments for eligible populations, please take advantage of those appointments. We want people to be vaccinated. Certainly, the health department vaccination clinics have been filling up quickly. We've had limited supply, and we're anticipating next week that things will be a bit different with more people eligible. We continue to be concerned about our 65 and older population being prioritized. So we continue to work with our vaccinators that are really working through their patient population. And we know that there are very large patient populations that still need to be gotten through for that 65 plus. So do know that we're aware of that, and we continue to coordinate to try and make sure that that vaccine supply is available to those that are still doing that 65 and older population. So with that, I think I will go to Audrey and ask if there are any additional questions.
We have a series of questions about our process for vaccinating seniors. So The first theme is really around how Eau Claire County is ahead of the state in the percentage of seniors that have at least one dose. So can you name if there's something that Eau Claire County is doing differently, something that has been key to that success, and kind of what that process has looked like in general?
Yeah, thanks for that question. I think it is encouraging that such a high percentage of our over 65 population has been vaccinated, and it is different than what we're seeing in other parts of the state. We do have a really strong vaccinator pool in Eau Claire County. So one of our clear strengths is that we have vaccinators that have ability to give vaccine. The state process up to this point has been very much a process that those that are able to give vaccine are allocated doses. It has not been necessarily based on the percent population that has been vaccinated. And there's an important reason that they start shifting their policy at a state level to make sure that places that have not gotten as much vaccine and have not been able to vaccinate their 65 plus population get more vaccine. It's hard for me to say that because it does mean that likely less vaccine will come to Eau Claire County because of that. But it's a statewide pandemic. We need people across the state vaccinated in order to get positive outcomes. So I do think one of the reasons that Eau Claire's percent is so high is because we've been getting a reasonably high doses of vaccine because we have vaccinators here. Other places don't have a number of vaccinators. I think in addition, we from the get-go have been working hard on messaging and coordinating between all of our partners that are vaccinators. We have an easy place to go, one place to find out who's vaccinating, one place to get a link. That's not true in every community. The state will soon be putting up a website that includes vaccinators, but that's not been available statewide, and it certainly hasn't been available in all communities. And then we've also really worked hard to coordinate resources where there is a place that those that are 65 and older can easily get a person on the phone to help them. Many in that 65-year-old age group may have some challenges with technology access, with barriers related to technology. Not everybody. My mother is someone at 84 that quickly got an appointment using technology, but not everybody is that fortunate. So we do have resources here locally to support that as well. The last thing I would say is that 65-year-old age group also includes many people in long-term care facilities. And we have a high proportion of long-term care facility residents in Eau Claire County. So that does mean, because vaccine was allocated directly through those long-term care facility pharmacy programs, that vaccine got out to those people pretty quickly. So I think it's not a simple answer. I think for a variety of reasons, we have a high percent of that population vaccinated. And our goal is that we need to get to 80%. So we have a ways to go. So we'll continue to push that age group's numbers up in every strategy we can think of.
A final follow-up question to that topic. How does it feel to know so many seniors are one step closer to being protected?
Yeah, having our older adult population vaccinated, I think, should be something that all of us just take a deep breath and have thankfulness for. We need good news during these times. We know that that age group is particularly vulnerable from the outcome data that we have. There have been negative outcomes with hospitalization and deaths in other age groups, but the vast majority of individuals across the state have been in that age group. So having a vaccine that is as effective as it is in really decreasing or eliminating hospitalizations and deaths for that age group is an amazing positive. We have work to do still to get more in that age group vaccinated, and the commitment is strong to do it, but I think it's all something that we should celebrate.
Another question about vaccinating educators. The state talked at length today on their briefing about health departments needing to submit their plan for getting educators vaccinated. Has the Eau Claire Health Department submitted one, and are there any details about that you could share that you haven't already talked about?
Yeah, each local health department in the state is being asked to submit a plan that identifies the number of educators we have per school district, per type of education entity. We've been asked to complete that along with some basic information about what our local process will be to offer vaccines to those groups. Again, that process, the plan that's submitted and vaccine that will be allocated, it's our understanding, according to those plans, will not start until after March 15th. We know that there's a strong push in this community through all of our vaccine partners and through the health department to try and get a significant number of doses into arms before even March 15th, but we know that there will be many educators that will not have been vaccinated by then based on the doses that are being received the next 2 weeks. We have worked with our vaccine partners and have signaled to them that our mass vaccination clinics will be a primary source of vaccine for our educators. We've worked with all of our childcare groups and our K through 12 education institutions to share with them that we will have clinics available for them in these very specific appointment schedules throughout our health department clinics, and that those clinic appointments will be designated for educators moving forward. So that will be our process here locally. We know that at the same time we do that, that there will be very clear messages out to all of our education partners that individuals are encouraged to also consider going to the other vaccine sites that are available in Eau Claire County, including their healthcare providers that they typically would see in normal course of their lives. So healthcare providers, our pharmacies, and a number of other partners will also be giving vaccine to educators, but our primary way to vaccinate educators will be through some of these larger settings. UW Eau Claire is also having a vaccine site for UW Eau Claire educators, and that'll be another pathway for educators in Eau Claire County.
There aren't any other questions in the chat box. Is anyone who is on right now interested in unmuting and asking a question directly?
All right, with that, I'll close. Again, thank you for joining us. We appreciate the time you invest in learning more about COVID-19. Do know that there is a lot of information that gets updated daily on our COVID-19 Eau Claire webpage. Please go there for more information. You can also call our call center number 715-831-7425. We'll be back next week, Thursday. It is March 4th, which is hard to believe, but we will be back the first Thursday in March next week to share more information with you. Thank you.